I had one patient with my nurse, and when I was doing cares for her, I kind of noticed that so she was on a ventilator, but I noticed that her hair was like really matted and just kind of in like a little tight bun in the back. And for those cares, we were able to move her to her left side. And I had a little bit of time after. So I went to the supply room and I grabbed a comb and some conditioner. And I know if you like water down the conditioner, you can kind of make a very weak detangler. And I kind of just spent some time with her detangling her hair a little bit. And then I was able to braid it and kind of just leave it looking a little bit nicer and not as matted. And I went back to sit with my nurse and chart for a little bit. And then when that patient's daughter came in, she noticed that her mom's hair was done and she just like teared up a little bit and like she just expressed her appreciation to us because she felt like her mom was really being cared for in a very like whole manner, and she really just was thankful to see her mother in better shape. And it made me realize that even just the little things that aren't super nursing related or that are ordered make a really big difference, especially the family, and or something that we'd want done for us or a family member in the hospital. And it made me just realize that, if you have the extra time, going the extra mile can mean a lot to the patient and the family member.
Oh, I love this. I hope they ask you this. Another thing you can kind of, because family members, sometimes they're scared to leave because they're scared like they need to be there, right? What if you could give the impression that she had said something to you about how seeing that someone takes such care and little details of how to make her mom not only safe, but comfortable and well taken care of, it makes her feel like her mom's in really good hands, and
Mm.
she has to go to work or something, that she knows you guys are taking really good care of her.
Okay. Yeah, she was kind of saying that to my nurse and I, so I feel like I could kind of just, yeah, she
Yeah.
was kind of saying that essentially. So yeah, I could definitely try to make a point to say that the daughter felt, yeah, that
I
her
was
mom was
actually
being
watching
cared
this thing on
for.
Instagram this week, and the question was like, it was just this like viral little reel. It was like, what's something that you see people do as nurses, and you're like, damn, it's a good nurse. And this girl was saying it's when people take the time to like do their patient's hair. That's the thing where she was like, respect.
Yeah, no, I mean, it's definitely something. I feel bad saying that story because I know in the future it's not totally realistic that I'd have the time to do like every patient's
No,
hair.
I did.
Well,
I
I
did my
mean, the problem
patient's
with
hair
that,
this
I think,
week. No, you're supposed
oh,
to.
that's so sweet.
Yeah.
I'm glad. Yeah, I'm glad you did that. That's so sweet of you.
I was
But
inspired
yeah,
by
no,
it.
I
I
think
was
it
like,
is
I
fun.
want to be the one she's talking about in the
That
video.
nurse. Yeah.
Yeah.
No, I always feel like for the patient, especially when they're on the ventilator, they're probably already uncomfortable and it's like a weird thing. And then the least I could do is like
Yeah.
make sure that their hair isn't. Oh, I'd be so upset if like I take all this care of my hair and then it's like all knotted up and nasty leaving the hospital. I'd be so sad.
Right.
So I don't know. It's
Well,
like
the
the
other
least
thing
you could
is
do, I
too,
guess,
like,
give it in.
even, when people die, right? There's someone whose job it is to like make them look nice
Make them
for
look
people
pretty.
who are viewing them or
Yeah.
whatever. Yeah.
That's a good way of looking at it. That's true. Yeah, it's
Yeah.
like a decency kind of for that patient.
Yeah.
But
Yeah. If you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72 question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview.
I have a couple of stories, but I want to share you this one. So during my med surg rotation, I have a patient who had a. But then one day I came in his room because I was about to walk her around the unit. So that's my job during that time. So and then I noticed that she was sitting on her bed and she said, "I don't feel like walking today." And then said, "Oh, what's up?" I told her, "Are you okay? Is there anything wrong?" And then she told me, "Well, it's my daughter's birthday today, but I wasn't be able to be with her. And then my husband is not gonna be here with me today too because she has to take care of their two daughters." So it's like at that time, I feel bad for her. So I said, is there anything in particular that you want to do right now so to make you feel better? And then she told, well, I want to see my kids, but then her phone doesn't have a charger, so she cannot call them on FaceTime. So, well, for me, because even though I'm not allowed to use phone, I always use an extra charger on my backpack. So I told her, well, let's do this. What about I'm just gonna grab my charger very quick and let's charge her phone, or um, if it's okay to you. And then I also asked my nurse preceptor because I'm not sure if I'm allowed to bring my own phone charger. So I asked my nurse preceptor if I can do that. So at that time, so she lightened up and she told me, "Oh, that would be very helpful." So what I did is I grabbed my charger and we charged her phone. And then I also noticed that her hair is like um when you're always lying down and your hair is like all messed up. So I told her, would you like me to brush your hair so when you call your daughter and your husband, you'll be more put together? Said, oh, that would be great. I also brush her hair, and she was so thankful. And we managed to call her daughter and sing happy birthday. And I even made like a little, when you blow the gloves and you make a little balloon and you put smiley face, and we used that one as like a fake balloon for her daughter. And then, well, the outcome of that is that she was very happy because she was able to talk to her daughter and to her husband. And she's kind of teary eyed because she didn't imagine that I would go the extra step to like even fix her hair so she can look up put together when she's talking to her family. Sorry, I'm kind of teary eyed while talking to that.
Aww.
Yeah.
Say one more sentence that bridges it forward, how that'll change the way you approach your other patients.
So with this experience, I learned that how little kindness go a long way when you actively listen to your patient. And as a nurse, it's very important to actively listen to your patient and show them compassion, because for us it's very routine. The work inside the hospital is very routine, but for them this is something new. And most of the patient don't have any like family members who can come in and visit them. And being compassionate and listening to them, make sure that even though just a little act of kindness, it goes a long way and it means to them really much.
Oh, the story is beautiful. I love it. I love
Yeah.
it. When she was in better spirits after everything you said, did she walk after?
Yeah, she walked
You
after
could say
that.
that. Yeah.
Yeah. So we
Because that's
basically
your
talked.
medical intervention, right?
Mhm. Yeah. So we basically talked to her daughter over the phone first, and then after that she walked on the unit.
Oh, okay, good. Okay. We promote a positive patient and staff experience. Tell us about a time you went the extra mile going above and beyond to meet the needs of your patient or customer. So this one is also one of the most common questions they ask. It's usually like, tell us about a time you went above and beyond, a time you provided compassionate care. There was a girl who she told me this story about, it was for a peds interview, and there was a kid who had to wear a helmet and they didn't want to wear a helmet, and she knew they liked cats, so she like worked with the unit secretary to print out little cat stickers and put it on the helmet, and then the kid was open to wearing it and could be in the play area with everybody. That gives you a picture that really sticks with you. Like you want to tell something like heartwarming for this one.
Okay. She should have got those little helmets with the cat ears, you know?
Yeah.
That would have been so cute. Yeah, but okay, so I have a good one because I had a really special connection with this patient. So he actually had from the flu shot, and so he was paralyzed from the neck down, and he had a trach. So to talk to him, you'd have to read his lips. And so a lot of people weren't really like staying in that room because he would take a lot of time. And since I was a nursing student, I gave him a lot of time. I was like, in there most of my day and really like writing on the board, filling out all of his paperwork about like his likes and like about his family. And he was able to share a story to me about his niece and how he missed playing tea time, and that his granddaughter had called him asking about when he's going to come home so that they can have tea time together. And we just shared a special moment. He cried, and I don't know, I can't say I cried, huh? You can't cry,
No.
like,
No.
that's the thing. It's just,
You
I
need to
don't
know the limit of like when you give too much of yourself to where you kind of deplete your stores for all your other patients, or if you get too attached, it can be really hard to run the code blue on that patient because it's like working on your own family member almost. Like you kind of have to keep some kind of professional level of separation.
Okay. Could
for
I
their
say
own good.
Okay. Could I say I was able to FaceTime? Like I helped him FaceTime his daughter because so that they could have tea time together, and I brought him tea.
Because that's like when you're telling the story, that's what I'm kind of hoping. I'm hoping you find a way to like, I'm hoping like there's some department that has like extra teacups, or like you're able to like somehow make this tea time thing happen.
Even though I just brought him tea, and then I was able to FaceTime his granddaughter, and she was able to do tea time over, and he just said some really sweet stuff to me afterwards that I was kind of having a rough day that day too with my instructor. So he was just like, you're going to make a wonderful nurse, and every patient you care for is going to be so thankful for you. And it really just stuck with me. And
don't say you were having a hard time with your instructor, because they'll be like, why? Like, is she a difficult student, or like what's and then bridge it somehow, like while you might not have that much time, especially as a new grad, while you're familiarizing yourself with all the new policies and procedures, you learn just taking even just the time to listen to what their preferences are can make the little things can make like a really big difference. It doesn't take a lot of time. You just listen a little bit, tailor the care towards them, and it can really make them more comfortable when they're having to stay in the hospital.
Okay, that's perfect.
Yeah, that's really cute. And I like the visual of the tea time.
Yeah.
Stick with them. They'll be like, the tea time girl, she was great.
I had a patient who came in, we were doing a full sepsis workup on her, and I needed to take a wound culture. So I needed to take the wound culture and then redress her wounds after. And she at first was really frightened, and she was kind of withdrawing her legs as I was doing this, because she told me that in the past some people really aren't careful, and that these wounds really are hurting her, and that she'd really appreciate if I was careful with them. So I explained to her, I was like, of course I'm gonna be careful. I'm gonna be as careful as I can. I'm sorry, it might feel a little bit uncomfortable, but I'll do everything in my power to make this go as smoothly and as pain-free as I possibly can. So I removed the dressings and was swabbing the wound, and she was just talking to me the whole time. And she's like, wow, I've really never had anyone as careful as you doing this. And I'm like, really? Thank you. I'm really trying my best to make you feel comfortable. And as I was cleaning the wound, we were just really getting to know each other, and she was asking how long I've been a nurse for, and I was like, no, I'm a student nurse, I'm not a nurse yet. And she's like, well, I know that you're going to make the most amazing nurse. And I was like, thank you so much. And she's told me just like how I was going to end up exactly where I needed to be, and that she has no doubt that I will make the most amazing nurse in the future, because I was the best nurse that she's ever had. And I ended up just really bonding with this patient, and she explained to me how she was really scared to be in the hospital. However, I brought this like warmth to her, and she said it wasn't only my care to her based on being careful with her wounds, it was also just the energy I brought into her room. And after I fully redressed her wounds and everything, I asked her if she needed anything else, and I told her that I would be able to turn off the light and close the curtain so that she might be able to get some sleep, because she was really tired. And at the end of it, she told me that she felt like she was in a resort. And we both just kind of laughed with each other, because I was like, oh, that's not something I normally hear from patients, that they felt like they were at a resort. And we just had a really great time together. And that's the type of care that I intend to deliver to every patient, just make them feel comfortable and safe and have their emotional needs met as well.
Yeah, I would maybe even lean a little bit more into her being reluctant to even let you unwrap her feet to do the culture, because then it highlights even more the fact that she did trust you. Lean a little bit more into like what she said, because I know she said a lot of things about you, but I'd like to be able to picture you kind of asking her about her life and her journey through her healthcare experience. Or I'm sure you guys like talked back and forth, like whatever she shared